Catherine Enderby writes, how can we get rid of Press Ganey and other patient satisfaction surveys and get back to caring for patients? Oh man, this is the million-dollar question. At Turntable, what we do is we get rid of, we don't use Press Ganey, we use something called Net Promoter. So at the end of the visit, the patient gets a survey. How likely are you to recommend this clinic to your family and friends, and your team to family and friends? At 1 to 10, and that's all we do. And then we aggregate those and we take their feedback as well so they can leave comments, and then we continually try to improve. And nobody's pay is based on that. It's purely so we can get better at doing what we do. And what we found is we tend to weed out patients who are coming to us for the wrong reasons. For example, they think it's a concierge clinic and they want their Xanax without seeing us, or they want their Vicodin, or they don't want to talk about the hard things like weight loss and things like that. They just want that knee replacement, etc. So those patients aren't a good fit. We often have a little come to Jesus with them and say, this is probably not working for you. Now, we can do that because our financial model is different. We're not part of a big system that's judging us, our productivity and our pay based on these things. So I think systemic change has to happen before we can get back to really caring for patients. And I think patient satisfaction is important, but how you measure it's important, and how you actually use that data is important. So that's a long answer to your short question. So Sarah Ann Henderson submitted a really long sort of piece about, why is it I go to the ED and they shove antibiotics and stuff at me without talking to me, without listening to me, without examining me, and then I'm charged $800 for this privilege and no one's really listening to me. And she says, honestly, I've seen CNAs perform more thorough assessments. Well, so here's an interesting piece, okay? And I think there's answers and solutions all the way around. So yes, I think doctors have been conditioned by, to some degree, patient expectation that they sit and they wait in the ER, which is, by the way, is the wrong place to wait for a lot of this stuff. If you had a good primary care doctor with the proper financial incentives and everything, like what we're trying to do at Turntable, you can see your regular doctor and they know you and they will spend the time with you. But if you're going to the ER for primary care stuff, it's very tough. The expectations on the doctor are that the patient wants an antibiotic, that they want a pill, they want some intervention to make it feel like it was worth all the time and effort and taking time out of their workday to come to see the doctor. Whereas if we just tell them, no, it's okay, it's a virus, or you spend the time laying on hands and talking, a lot of doctors feel like, well, in the end, the patient gets upset, lowers their Press Ganey satisfaction scores because they're not getting that pill or something they want. It's really hard. I think physicians are being conditioned to behave this way instead of taking the time, laying the hands, getting another patient. So I think the answer is, we need a better system of primary care and prevention, better patient education, right, around when antibiotics are appropriate, et cetera, but also better physician education around how to talk to patients about this stuff, understanding that time is limited, resources are limited. If we can fix the system around it, then those resource issues become less of a problem. But as it stands, man, it's a challenge all the way around. Dr. Neil Desai asks, knowing what you know now, what would you say to your children if they wanted to be a doctor? Oh, man. I could honestly tell my children that for the first time in the history of me being in healthcare, I couldn't imagine being more excited about the future of healthcare. We're at a pivot point where we're moving into this Health 3.0 scenario, and we just don't have any choice. We're going to do that. And so we're going to restore this profession to that sacred calling that it always should have been and always really has been at heart, which is being with vulnerable people when they're at their most vulnerable, and being there to help, and then making yourself a little vulnerable in return. That is a gift that every single day you get to do in healthcare. I would tell the Z-Pups, there's no higher calling I can imagine than to be a healer. But I would also say, if there's anything that they are passionate about more, they should do that first. Because pursuing what you are uniquely passionate about is the key thing. And if it's not medicine, medicine is so filled with self-sacrifice and having to give up all your 20s and your 30s and your 40s and your 50s and your 60s and sometimes your 70s, that you need to pursue what you're passionate about. If you're not passionate about medicine, you need to go do something else. Now, if you're passionate about medicine, you will always find something within that niche, whether it's being a nurse, being a subspecialist, a physician, being a nurse practitioner, being a PA, being a respiratory therapist, being a dietitian. It doesn't matter. You will find it, or it will find you. And you have to just be open and leave yourself open so that those lucky little coincidences that happen will guide you down your path. And so that's what I'd tell my kids. It was a huge year for ZDogg Industries. We dropped our biggest hit of all time, Readmission, 1.4 million views and counting. We did Ain't the Way to Die, which was a sort of a really important piece to me about end-of-life care and how we screw it up in this country. We did EHR State of Mind, which is a stiff middle finger to crappy electronic health records that ruin the doctor-patient relationship and do not let doctors be doctors or nurses be nurses or RTs be RTs or pharmacists. You get the picture, right? But we couldn't have done any of it without you. So I'm so filled with gratitude for all the Z-Pack this year who've just been so supportive, been watching the videos, sharing them, and just keeping this movement alive, because that's what this is. It's a movement. So for 2016, we are going to take it to the next level. And that needs your help. We want to do a show. We want to do more videos. We want to transform healthcare. Nothing less than transform healthcare. To do that, you need to help us. You need to follow us on Facebook, because that's where all our interaction occurs. But we need you to subscribe on YouTube, because the more subscribers we have, the bigger our audience is for the videos that we put out. The more clout we have with YouTube, the better we can get our word out and actually start this movement rolling, because we want to steamroll over crap that's destroying healthcare. You know what I mean? You're a part of it. Nurses, doctors, pharmacists, RTs, PAs, nurse practitioners, dietitians, social workers, case managers, everybody needs to be a part of this. I'm begging you. Don't make me beg. You wouldn't like me when I beg.